Hi, my name is Kerrington. What's your name?
Your patient's name is Jadida. Jadida.
Nice to meet you. Where are you from?
Okay. She's from just outskirts of the town.
What do you do for work?
Are you asking the mother what she does for work or
Yes.
the child? Okay. What do you, she's a farmer, small scale farm.
Okay. Can you ask her what brings her in today?
Okay. She came in today with fever and cough, then a running nose for 4 days duration.
Okay. And can you ask her about the fever? Is it consistent or does it come and go?
The fever comes and goes.
Can you ask her what her diet has been like?
So what is your diet like? Diet like? Yes. How many times you eat in a day? We eat 3 to 4 okay, times. Okay. So especially her. Okay. She eats a bunch of food. Okay. The child, the child's diet is basically breast milk, but she has some complementary feeds that she eats 3 to 5 times a day. And
Okay.
it's usually carbohydrate based, isn't it? I used to do some brown for her. Okay, okay. So carbohydrate based and some it's kind of balanced diet. Strict kind of balanced diet.
Okay. And can you ask her if she's coughing at all?
Yeah, she coughs. She's
Oh.
coughing.
Okay. And when she coughs, does anything come out?
No, nothing comes out. But she has a running nose.
Okay. And is her eyes are they yellow at all?
No, no.
Okay. I would like to run a rapid diagnostic test.
Okay, okay. It was done and it was rapid diagnostic test for malaria was done. And it's positive for malaria.
And then I would also like to run a X-ray for ARI
Okay. X-ray of where?
of like the nose area, the lungs, excuse me.
Okay, okay. So that will be done. So what is your diagnosis? What are you thinking?
I'm thinking that the patient suffers from an upper ARI and malaria.
Okay, okay. So how are you going to treat the patient?
For the malaria, I would put her on ACT, and
Mhm.
for the upper ARI, I will put her on antibiotics.
So any preventive measures?
Yes, I will make sure that when she sneezes or she coughs, she makes sure she has proper etiquette. So she's sneezing and coughing into her arms. I'll make sure for the malaria that if she's able to get a mosquito net, she can invest in a mosquito net. But if she's not able to, that she makes sure she kills any bugs that she sees around. And yeah,
That's very good. That's very good. So can I give you my feedback?
yes.
Okay, okay. So that's a very good attempt. You've covered all the aspects, all the relevant aspects. You've asked around the symptoms. You've asked necessary questions and important questions around the symptoms, and you've utilized the information that you've gathered to suggest an accurate diagnosis. You've also ordered relevant investigations. Only that for acute respiratory tract infection, if you are suspecting it is upper respiratory tract infection, you may not require an X-ray. But if you are suspecting a lower respiratory tract infection, that one you require an X-ray to rule out pneumonia. Rule out
Okay.
pneumonia. Yeah.
Okay.
Or if there is if the fever is marked, if the fever is significant, you could also order for throat swab.
Okay.
Throat swab, microscopy, culture, and sensitivity. So if they run the test, they may tell you whether it is a bacteria, whether it is a bacterial infection. So if it is bacterial infection, then you use antibacterials to treat it. But for the malaria, you've done wonderfully very well. You've made
Okay.
the diagnosis, you've given the necessary, appropriate treatment, which is ACT, isn't it? Which is ACT. And then preventive measures, you've recommended absolutely very important preventive measures for malaria, which is to combat the mosquitoes. If you can stop the mosquitoes from biting an individual, he may not come down with malaria, because malaria is transmitted by mosquito bites. So if you can prevent the mosquitoes from biting an individual, you are automatically preventing malaria. So that is a very good attempt.
Thank you.
You're welcome. You keep it up.